If you are watching this video, it means that you are about to embark on the Tiers of Service self-assessment process, and we hope this video is helpful to you. The Tiers of Service framework provides a guide to the responsibilities, requirements, and critical patient volumes needed to provide safe, sustainable, and appropriate level of service. Applying this approach helps us to ultimately meet our goal of improving the health services for the health of children across the province. The Tiers of Service approach facilitates the planning and development of services appropriate to meeting the needs of children locally, regionally, and/or provincially. Service levels are expected to align with the service needs of children living in the team's geographic area of focus. For example, Tier 1 services are usually community-based, including primary care, and not delivered through a hospital. Tier 2 are those delivered through a smaller local hospital. Tier 1 and 2 become the foundations of the system, serving the whole population, including children, but not exclusive to children. This is where most children receive their care. Tier 3 is a more child-focused health service, which is supported by a local pediatrician and is community-focused. Tier 4 and 5 are regional pediatric services delineated by the degree of specialization. At Tier 4 and 5, there are dedicated pediatric inpatient units and ambulatory services, with Tier 5 offering some subspecialty pediatric care. Tier 6 is our provincial subspecialized services that serve children with the greatest complexities and require a number of subspecialty interventions. Service providers at Tier 6 work exclusively with children and youth, and the full range of pediatric subspecialties are available. Tier 5 and Tier 6 have a responsibility around driving out knowledge and research, as well as helping to support quality improvement across the province. In this diagram, you will notice that patients will flow to a higher level of tiered services by referral as needed. However, and most importantly, they will return to their healthcare home in their home community. This is a quick overview of our Tiers of Service framework. When the tiers of service are created for a particular service, all of the responsibilities and requirements for each tier are laid out in a module. This module is based on the best available evidence, jurisdictional review, and consensus of provincial, operational, and clinical experts. Once the content of a module is developed and accepted, the module is sorted into what are called tier-defining and non-tier-defining criteria. This step prioritizes criteria within the module. Tier-defining criteria are those that characterize a given tier, those which, if not met, would create patient safety or system risk. Once complete, the next step is to use the module and its criteria to conduct a self-assessment. The purpose of self-assessment is to identify the current state of services within a facility or organization with respect to the responsibilities and requirements outlined in the modules. This self-assessment is what you are going to be undertaking. Depending on the module, you may have 1 or 2 phases for the self-assessment. This video will describe the 2 phases. However, please note that your self-assessment may be condensed to 1 phase. Phase 1 is a face-to-face or telephone interview where we'll gather information about your services as identified by the tier-defining criteria. You'll have an opportunity to validate the responses you provided before proceeding to the next step. Phase 2 is a follow-up online survey that is tailored to the responses provided in Phase 1 and includes the non-tier-defining criteria. This second phase completes the full tier self-assessment. The analysis for Phase 1 and 2 then defines any achievements and opportunities within the tier. Once again, you'll have an opportunity to validate responses provided to ensure accuracy. From here, a set of reports for the site for the health authority and then for the province as a whole will be completed. So how can you prepare for the self-assessment phases? In order to complete the self-assessment, you may want to pull together a small group of people who can help outline the services and provide evidence about the criteria in the module. For example, it may be an operational manager, clinical educator, department lead, medical director, or physician who knows about the layout of the facility, resources at the site, and service offerings for the particular module that is being self-assessed. Familiarizing yourself with the module would also be helpful. Links can be found on the Child Health BC website. We're not expecting you to know all the terminology and language in the Tiers of Service modules. Our job is to bring that information to the table. You are the experts in the resources and services that you offer at your site and in your health authority. Together, we will complete the self-assessment and ensure that we capture your services accurately. Data provided through self-assessment is not shared without permission to the general public. A high-level provincial summary will be accessible through the Child Health BC website. Again, the outcome of the self-assessment is to generate a series of reports which will be directly useful in supporting service plannings at local, regional, and provincial levels. How will this be important to you? The reports will help with planning and standardizing appropriate clinical services at your site and across health regions. This will help ensure that children can receive a high standard of care no matter where in the province they live, and clinicians will be supported in providing this care. Rural areas have found this information valuable in their planning. It can also help inform your capital and help human resource planning. We look forward to working together on the Tiers of Service self-assessment with you. To learn more about the Tiers of Service, contact Child Health BC with any questions you may have. Thank you.